I want to introduce this patient, 67-year-old male with large kidney mass that was incidentally found into a CT scan of the abdomen. He also had pulmonary lesions which were suspected to be metastatic lesions from the kidney cancer. He came here and he requested to be evaluated by complementary treatments. We initially did the labs and we found that he had extensive increase in the angiogenesis markers, interleukin 8 and vascular endothelial growth factors. All these markers showed us that his cancer was in a trend of spreading and metastasis very quickly. He was lucky because he started the treatment right away and he received 2 weeks of IV epigenetic therapies. After 2 weeks of treatment, we repeated the labs and the labs showed substantial drop in all markers. All these markers came down to the normal level just in after 2 weeks of treatment. His interleukin 8 dropped from 448 down to 16, and his VEGF dropped from 248 down to 58. This quick response to the IV epigenetic therapies showed a very, very complete response and a very positive response in his case. We are looking for a complete remission in a matter of few weeks in his case, from a stage 4 renal cell carcinoma to a complete remission in less than a month.
Hi, my name is John. I'm here at Dr. Nizami's. I have been diagnosed with renal cell carcinoma, and I'm being treated with IV therapy and hyperbaric oxygen treatment before I have my surgery. I found out about Dr. Nizami about 2 years ago. A friend of my wife's had cancer and she had surgery, didn't want to do the chemo and the radiation and decided to do alternative stuff, which she knew that I had a little bit of knowledge of that. And she didn't want to do the chemo and the radiation, so she tried those therapies, other therapies. And in the meantime, I kept looking online for other sources of alternative therapies that could maybe help her. And about 6 months went by and she wasn't getting better and wasn't going to get any better, and she eventually passed away. Probably about 6 months after she passed away, I was doing some more research on alternative cancer therapies, and I was wondering who in the area does IV vitamin C, because I know that's one of the alternative things that helps a lot of people. And so I Googled that and I found Dr. Nizami did that, but he also does other things too in addition to that. I first got exposed to the alternative cancer therapy from one of my colleagues at work who had tongue cancer and had surgery and radiation, and came back about a year later. She had more surgery and chemo and radiation, and it came back again. And finally, 6 months after her last sessions, it came back, and she said they told her there was nothing more they could do, and she needed to look elsewhere for help. So she and her husband asked me to help them look online to find out that there are any alternative cancer therapies that really work, and to let them know. So that began like a 1.5-year search. She eventually passed away. There wasn't anything that really helped her out a lot. She was too far gone, and so anyway, that exposed me to the whole alternative therapies to cancer treatment to begin with. It took me on a journey of reading over 10 to 15 books on cancer, scouring lots of websites, and finding out about some alternative therapies that do work. But a year or two after that was when my wife's friend got sick with cancer, and I did more research, and she used some of the things that I had learned about, some of the books that I'd given her, and it helped her to a certain extent, and then she too began to fail. It was too late. So then I came to the point where I was looking for somebody who does IV, vitamin C, and other alternatives, and that's when I found out about Dr. Nizami. It was nice to know that. I didn't have anybody else that came to me that I found out that might need this kind of treatment, but 2 years later, I myself was diagnosed with renal cell carcinoma, and I went online to see if he was still available and if he was doing more research on this, and he is. What I found different from when I first saw him and when I saw him 2 years later is that he's obviously gone from more to the more scientific end of the treatment, using lots of different things other than vitamin C to help combat the cancer's ability to create angiogenesis and supply itself with all the blood it needs, to help fight cancer stem cells, to help fight, to build up your immune system. Those are all things that really were attractive to me. He's got a great website. I went to it and listened to all the things that he had to say, and the one that stuck out the most to me is if you have cancer, give me 2 weeks. Just give me 2 weeks to do my therapy, and we'll see how much the tumor markers and everything come down, and we'll know if this is going to be beneficial or not for you. And so I wanted to try that out. So that's what actually brought me here. I've done my 2 weeks. The results have come back. My tumor markers are all down. I'm ready to go to surgery to have my tumor and my kidney removed. I'll do some treatments right beforehand. I'll have the surgery, and then after the surgery's over, I'll do some more treatments, and then we'll do some blood work and see where I'm at. But right now, things look really good for me. I see myself as kind of a lucky guy. And I recommend anybody out there who's scouring the internet and you come across Dr. Nizami's site to take it seriously. Unfortunately, insurance doesn't pay for it, but there's so much that insurance does pay for. And I mean, how can you put a price tag on your life? So that's my story. I have a lot of faith in Dr. Nizami. One of the things he talked about in one of his lectures was he's starting to see himself now more as a scientist, because what he's learned so much in the last 5 or 6 years has really pushed him in the direction that he has a much better handle on understanding cancer and what we can do with alternative non-toxic therapies to help get you better without having to do chemo and radiation. So, those are all positive things to think about and anticipate, and, give him a call if you need his help. He's there. I know there's a lot of people out there who really don't know about this type of treatment. Most people are familiar with, if you have cancer, you see your doctor, they send you to an oncologist, they do chemo. After the chemo's done, they usually do radiation treatment, and that's what most people think is the way that cancer is treated today in our society. And there is an alternative way. I see Dr. Nizami as a pioneer, and he can help you understand more what your cancer is about, and can work with you to help do things with IV therapy and hyperbaric oxygen that is going to help you get better. If you are just searching the web and you find out about this and you're wondering if it's valid or not, please watch the videos, listen to all the lectures that he talks about. If you need to call the office and come down for a consultation, you know, everyone that works down here is really involved in this treatment, and they can help you understand better what's involved, how it's going to work for you, as opposed to conventional treatment. Dr. Nizami, he does work with conventional oncologists. In fact, many of them send him patients who are really hard for them to treat. They're at their wit's end. They don't know what's going to really work, and they'll refer patients to him, and he will help figure out what's going to be the best remedies to help move that patient forward. So he works with conventional therapy, even though some of this has come from the alternative end and is still considered to be alternative. He moves more in the direction of the scientific end of it, as opposed to the far reaches of the alternative end. The main problem that I see with the alternative approaches is that they can't get enough of the nutrients that you want you to take into your bloodstream to reach a real therapeutic level where it's going to have an effect on you. And Dr. Nizami has all that here, and you're given it in an IV drip, and it really has a much better chance of helping you than just taking the supplements and the other type things that are available out there. So I encourage you to scour this website, and if you need to, call the people down here, come for a consultation. Those things are going to be really essential for your well-being.